White House Press Secretary on Thursday said it doesn't matter where President Joe Biden contracted COVID-19 and that the most important thing is that he was fully vaccinated and double boosted. President Biden tested positive for COVID-19 on Thursday morning and is experiencing mixed symptoms, including a runny nose, occasionally dry cough, and fatigue, the White House said. Reporters asked White House coronavirus response coordinator during a press briefing where Biden may have caught the virus. After just said he doesn't know, the White House press secretary interjected to say it's not important.
Look, I don't think that matters, right? I think what matters is we prepared for this moment. I think what matters is what Dr. Jha just laid out. If we look at where we were a year and a half ago, this is a president, when he walked in, one of his first priorities was to make sure we had a comprehensive plan to get people vaccinated. And so now today, look to today, more and more people are getting closer to having a more normal life. Vaccines are available, and as Dr. Jha said, if you have not gotten vaccinated, please do. If you have not, if you have not gotten boosted, please do. These are treatments that are going to keep you safe, and I think that's what matters here, is making sure that we continue to do the work. And the good thing is that the president again has been vaccinated and double boosted. Given that he meets USA Food and Drug Administration, FDA, Emergency Use Authority criteria for Paxlovid, I have recommended initiating such treatment. The president is fully vaccinated and twice boosted, so I anticipate that he will respond favorably as most maximally protected patients do. Early use of Paxlovid in this case provides additional protection against severe disease. He will isolate in accordance with CDC recommendations. I will keep your office updated with any changes in his condition or treatment plan. I also wanted to provide you with a brief readout of the president's activities today. The president has been working from the residence, like so many of us have during this pandemic, doing calls with senior staff, including the chief of staff, myself, and Dr. Jha, who's here with us. As we read out, the president also called Senator Casey, Representative Cartwright, mayors of Scranton, Mayor of Wilkesboro, and Representative Clyburn. The president also called a few of his cousins from Scranton who were set to attend today's event in Pennsylvania. And he spoke with Ambassador Giddenstein and Cornyn. You all have seen the photo he posted on and the video that was just released to all of you out of transparency moments ago. The president will continue to work from the residence. Today, as you all know, as I just mentioned, and as we sent out earlier, Dr. Ashish Jha, our COVID-19 response coordinator, is joining us today in the briefing room. And as I tweeted out earlier, Dr. Jha and I spoke to the president this morning, and he said he's feeling fine. He has a little dry cough, as I just mentioned from the doctor's letter, a little runny nose. He's feeling tired, but he's working very hard on behalf of the American people. And with that, Dr. Jha?
Guidance on this is very clear. You have to isolate for 5 days. CDC says that you can resume after 5 days without a negative test, as long as you wear a well-fitting mask. We go above and beyond that at the White House, and the president will get tested. And as long as he's isolated for 5 days, meeting the kind of CDC requirement, we will wait until he gets a negative antigen test, before he returns to activity.
Go ahead, Steve.
How does the White House adjust to having a president with COVID? Who has access to him? Is he staying in one room, a series of rooms? What's the physical situation?
So as I just stated, he is isolated in the White House residence. Look, the president could be a president anywhere, right? It doesn't matter where he's located. He has the technology, he has the tools, what he needs, the communications, what he needs to continue to doing his job.
And has staffing here been adjusted at all? Fewer people around?
There has been no change to our protocol as of date. I think you just asked. No, I gotta go around. Your colleagues are gonna kill me. I gotta go around. Go ahead, Tam. We'll go to the back.
I just want to parse the timeline a little bit. I think there may be a comma in the doctor's statement, and I just want to clarify. Did he start experiencing the cough last night? or all of the symptoms last night? I guess my question is, when did he start experiencing fatigue? When was the first sign of fatigue?
Yeah, I mean,
Spoke to the doctor.
I spoke to the doctor. I spoke to the president. You know, my understanding is, again, his doctor spent a lot more time with him than I. I mean, and I haven't spent time with the president. I just spoke to him on the phone. The president felt well all day yesterday. I think late in the evening, he felt some amount of fatigue. After a long day of travel, I don't know. There are a lot of late evenings where I feel some amount of fatigue. I don't know about all of you. He went to bed. I asked him how he slept. He said he just had a bit of a restless night. And this morning got his routine tests that he does. And then when Dr. O'Connor probed him further on symptoms, because he tested positive, that's when he mentioned, yeah, that maybe I was a little tired last night. So I really think his symptoms, you could say, either began late last night or early this morning.
Did he have any fatigue or runny nose or anything like that on Sunday, Monday, or Tuesday?
He felt totally normal and said that he felt, at least to me, he said he felt totally normal all day yesterday.
Has he experienced any fever or brain fog, other symptoms of COVID?
He's had no fever.
Okay, and could we get the president's position here so that we can not play the game of telephone?
I don't think this is a game of telephone. You have Dr. Jha, who is a medical doctor himself, who runs our COVID-19 response. You're going to hear regularly a statement from Dr. O'Connor. And so we are going to be as transparent as we are going to be transparent as we have been. We put out a statement this morning. We put out a letter from Dr. O'Connor. You have both of us here taking your questions and answering them. You saw a picture of the president, you saw a video of the president, and so we are doing this very differently, and we're going to continue to provide information for all of you and also the American public. I'm going to continue to go around. Go ahead.
Thank you so much. While doing contact tracing, will you reach out to some of the officials the president met last year while traveling abroad, or is that too far away?
Yeah, so contact tracing for people in the last 48 hours who were after he tested positive. So if somebody met with the president a week ago, they would not be considered a close contact.
You won't, search for maybe people like positive with COVID that he met like last week, or that's.
Are we going to go looking a week ago to see who might have given? That's not. I mean, no. The purpose of contact tracing is to make sure that anybody who might have been exposed is so identified to prevent onward transmission.
Okay, Karen.
Thanks, Karine. To follow up on Steve's question, I think you had said that there was no change to protocols here. Do you mean the West Wing for change of staffing protocols?
I think that was Steve's question. I just don't have an update on that.
How about the residents, though? Is there a reduction in staff while the president's in isolation?
Well,
and
we're
how
gonna
are operations
we're gonna
for
follow
residents?
CDC guidance, right? Which is for the president to isolate and to make sure there is a very, very, very minimal footprint, because our goal is to make sure that we keep others safe.
So there are limited people that will be around the president for the next.
Yes, if anyone, to be quite honest, because we are going to follow CDC guidance.
And to follow on what you had said earlier about we'll be getting updates from Dr. O'Connor, will that be statements every day
There'll be
coming
statements.
from you?
It'll be daily statements from. It could be directly from him. I believe it'll be directly from him, but you will get a daily statement.
Won't necessarily come here and do a briefing. with
We're
you
going
guys.
to give daily statements, just like we provided the letter with transparency. The letter he provided to me, we made sure that you all saw, and we'll continue to make sure that you guys get an update on the president on a daily basis.